Hello, and welcome to Do You Mind? Community-led responses to 2SLGBTQ plus youth mental health. My name is Brooke Biggin. I'm the program director at CBRC, and I use pronouns he and him. Unfortunately, Fazia couldn't be with us today, and so you'll have to settle for me. My apologies, but we'll get started. So first of all, we'd like to start with a land acknowledgement. And so the Do You Mind program runs across Turtle Island. Today I'm sharing with you from Treaty 6 territory, a traditional meeting ground and home of many Indigenous peoples and nations, including the Cree, Dene, Saulteaux, Blackfoot, and Nakota Sioux, as well as the Métis, Inuit, and nations not represented by the treaty. We cannot engage in the work of addressing the health of 2SLGBTQ plus people without considering the ongoing and historical impact of colonialism and settler structures on the First Peoples, especially those who are Two-Spirit. We also acknowledge the historical oppression of Black people and people of color. The history of white supremacy in Canada, North America, and globally has resulted in long-lasting damage. We need to name that harm before we can begin to address it. We all play a role in shaping a better world. So before we get too far into discussing the program, just a brief introduction of the Community-Based Research Center for those of you who are new to our work. So CBRC was incorporated in 1999. Our main office is in Vancouver, BC, but we also have satellite offices in Edmonton, Toronto, and Halifax. CBRC promotes the health of gay, bi, trans, Two-Spirit, and queer men. Historically, this really made sense given the organization's focus on HIV and the disproportionate impact of HIV on this population. However, more recently, through programs like Do You Mind, both our team and the work we do are evolving to become more inclusive of the broader 2SLGBTQ plus community. For those of you who are newer to our work, you can go to cbrc.net and you can learn about some of the different projects that we're currently implementing across the core pillars of our work, which include community-led research, knowledge exchange, network building, and leadership development. Next slide. So the objective of today's session is that you can hopefully learn a little bit about the Do You Mind program, about some of our experiences, and that you can apply those learnings within the context of your own programs, services, and practices. In terms of what we'll cover, we'll talk a little bit about the background of the program. We'll provide a high-level program overview. Ricky will then join to share some evaluation highlights. We'll then hear from representatives from our different delivery partners for a panel discussion around the different sites' experiences of running the program. We'll cover some key learnings and some of our future plans, and then we'll end with a Q&A where we can hear from you. And so once we get to that point or throughout the session, if you want to pop some questions that you have into the chat, we'll try to address those at that point in the session. So a little bit about the Mental Health Promotion Innovation Fund. So the Do You Mind program is funded through this fund by the Public Health Agency of Canada. The Mental Health Promotion Innovation Fund supports the development and delivery of community-based youth mental health program and aims to address health equity, to build protective factors, reduce risk factors, and address the underlying determinants of health. What's interesting about the fund is that it employs a gated approach. And so currently we're in phase 1, which is really for the initial project design, to pilot your program, to help develop some of the partnerships that you will need to successfully run the program throughout the time. The projects that are most promising then can apply to become a part of phase 2, which includes full implementation of your project with partners. And then the most promising projects at that point may apply to become a part of phase 3, where you really look at scaling up your program and expanding implementation. Now, in order to work through those different phases and help identify the most promising interventions for youth mental health programming in Canada, there's a special focus on research and evaluation and knowledge development and exchange. So for example, all of the evaluation tools that we use to measure the impact and effectiveness of our pilot, everything had to go through a research ethics board. There's a unique KDE, so knowledge development and exchange hub, that has been created so that all of the different projects that are funded by the fund can share their learnings and experiences, so that we can really start to build that system-wide impact and change. So looking at this particular opportunity, we were definitely interested, and we wanted to look at whether or not CBRC aligned with the objectives of the program. And so we looked to our existing community health leadership programs. So before Do You Mind, we'd already developed and implemented Totally Outright, which is a community health leadership program that focuses on community-based health promotion, Investigators, which focuses on community-based research, and Pivot, which focuses on systems change. And so we already had this model of community health leadership programming, most often focused on young adults, and we felt that that could potentially be adapted for this particular fund and project. We also already had a national network of delivery partners. So for example, the CBRC coordinates a national alliance, which focuses specifically on HIV and sexual health. We also have a network of program delivery partners who deliver Totally Outright, Investigators, and Pivot all across the country. And so we felt that we could leverage that network for this project. And then we also looked at our existing research assets like our Sex Now survey, which provide us with data about queer men, and some other surveys that are emerging, which focus more broadly on the 2SLGBTQ plus community. And so we felt that we could leverage those data assets to have a better understanding of some of the unique needs of this population. And so what we did then is, just the next slide, we brought together a group of partners from across the country. And so you'll hear from them in just a bit, but just in brief, in Edmonton, we have the EMHC. In Vancouver, we have YouthCO. And in Halifax, we have the Youth Project. And really, we approached these partners, many of whom we already had a relationship with, and asked, hey, there's this really great opportunity. We have, these programs that we think would be a good fit. Will you work with us to adapt and then pilot the delivery of a new mental health community health leadership program for youth? And fortunately, all the partners agreed, and then we got to work. So looking a little bit about the structure then that we developed for the program, really the community health leadership programs that CBRC already delivered had 4 core objectives. So we like to say that our programs have BITE. So they build connections between participants, they improve health literacy, they train in practical skills, and they empower to solve challenges in community. And we've seen that that model is successful with our other community health leadership programs. And so instead of starting from scratch, we decided to take the model that works and adapt it for a focus on youth mental health. And so in terms of how those objectives informed our program structure, for objective 1 around building connections, that meant repeated engagement opportunities. And so for the Do You Mind program, you'll find that all of the participants have multiple opportunities to connect with each other, mainly online because of COVID, but through different workshops and learning sessions, working together on developing their community health leadership projects, just multiple times to build those relationships. In terms of objective 2, so looking at improving health literacy, we developed a mental health literacy curriculum. So this was a little bit of a departure from our previous programs, because those were often programs that emerged to address sexual health needs within the community. And so what we did is we worked with our partners and with some other experts to develop a mental health literacy curriculum. And you'll see some core modules that we developed were foundations in understanding 2SLGBTQ plus mental health. You'll see another one, reclaiming queer narratives and building community care. Those were a part where participants were able to come and just learn about mental health, and particularly queer, trans, and two-spirit mental health. For objective 3 around training and practical skills, we developed a skills building component of the curriculum, which was focused on community-based health promotion. And often people would come in experts from the community, people who have experience in community health promotion, and they would connect with our participants, share workshops, do lots of practical exercises to build those skills. And then finally, the fourth objective around empowering to solve challenges in community, really that involves a participant-driven pilot intervention development and delivery. And so once participants learned about mental health and gained some of these practical skills, they were able to come together and say, what's a mental health challenge that we want to address within our community? And then they were supported in actually developing an intervention concept and then the actual delivery of those interventions within their local communities. And we'll share more about those in just a little bit. Now, just quickly looking at the Do You Mind timeline, you'll see back in spring of 2020, we were working on the curriculum. In summer 2020, we moved into participant recruitment at each of our partner delivery sites. Over the summer and fall of 2020 is when participants engaged in curriculum delivery. Then the intervention development happened in autumn and winter of 2020. The actual delivery very recently in winter 2021. And now we're sharing some of that knowledge with the broader sector. A few key things to consider is that, this really all happened during COVID-19. And so we were ready to go and deliver this program in person like we have with most of our other community health leadership programs. But with COVID, all of a sudden on a dime, we had to work to adapt all of these sessions for online delivery. There were definitely multiple delays as well. So it's definitely some unique challenges and opportunities. And we'll speak a little bit about that today, particularly our delivery partners. And hopefully as we dig a little bit farther into the evaluation data analysis, we'll be able to share more in the future around how we responded to COVID that hopefully you could implement within your local context. So given that little bit of background, again, we only have so much time today. There'll definitely be an opportunity to engage with us if you're interested in more information. But I will now turn it over to Ricky, who's going to share about the evaluation highlights from the program.
Thanks, Brooke. So for Do You Mind, there were several domains or areas that we have been prioritizing for evaluation. Some of these directly relate to the goals of the Mental Health Promotion Innovation Fund, including looking at whether participants report increased knowledge or skills, positive behavior change, changes in protective factors, and improved well-being. And a lot of these goals overlap nicely with CBRC's own community intervention goals, which Brooke has already talked a little bit about using the BITE acronym. So when we're looking at personal health literacy and increases in participants' skills, we look at things like knowledge and skills and behavior change. When we're looking at increases in community and personal connections, we're starting to get at some protective factors. And when we look at improved well-being, we also can get a sense from that as well. Goal 4 around empowering participants to solve challenges in their community is a little bit more unique to CBRC's community interventions. And we also do some process evaluation to get a sense of participants' experiences with the program. So we're going to look at some findings in those areas in a little bit. But first, I want to highlight our evaluation strategy. So CBRC used, or at least for Do You Mind, we used a mixed methods approach for evaluation, which included conducting surveys and focus groups with our participants and a few other stakeholder groups. We also used an experimental design where we did some of this data collection at a few different time points, including administering surveys before participants started the program through a pre-participation survey, post-programming survey after participants completed the program curriculum, a post-intervention survey and focus group after they completed their pilot intervention projects. At that time, we also did some pilot intervention surveys with the individuals who participated in the pilot interventions developed by the Do You Mind participants. In a few months, we'll be doing a follow-up survey with the Do You Mind participants. And we're also about to start doing some data collection for our knowledge sharing activities and with our delivery partners, including a survey and focus group with those partners. We've started to look at the data from a few of these time points, particularly time points 1, 2, and 3. And so I will focus on some evaluation highlights from the data that we have with from the data collection that we got from our participants, as well as later the pilot intervention participants. So in terms of health literacy, we found that 82% of respondents reported increased health-related knowledge, and 71% reported increased knowledge of the skills learned to respond to issues affecting the mental health of one's community. So this is getting a sense of the health literacy and CBRC goals 1 and 2. In terms of applying knowledge and behavior change more specifically, 76% of participants reported that they agreed or strongly agreed that they intended to apply the knowledge learned through adopting at least one positive health behavior or harm reduction strategy. And 65% of respondents reported that they developed new social connections with other participants. Now, historically, a lot of CBRC's community health leadership programming involves multiple in-person meetings, which can aid in building social connections as participants have the chance to hang out between sessions, eat lunch together. With COVID, a lot of program activities had to be moved online. And so there were less organic opportunities for these kinds of social interactions. Now, 65% of participants reporting that they developed new social connections is not a bad result, but we expect this might have been higher if we'd been able to do a little bit more in-person programming. And some of this has been echoed in other evaluation activities that we did with the program. But before we get there, a few other measures. So looking at improved well-being, one of the measures that we used to look at this was a scale called the Flourishing Scale. We administered a few scales at each of the different data collection time points, and the Flourishing Scale is one of the most comprehensive scales and is a measure of psychological well-being. On this scale, between the pre-participation and post-programming surveys, 53% of respondents reported increased scores, so demonstrating improvement in this specific predictive factor. 65% of respondents also reported that they intended to apply the knowledge learned by accessing at least one new health or wellness service or support, or by accessing a currently used health or wellness service or support more frequently. So also highlighting some of the specific actions that respondents were taking in order to improve their well-being. In the surveys, we collected some qualitative data, and there were two areas or common themes in those data. Very common one was people spoke to how the program increased their connections to community. So one participant wrote that the program makes them feel more part of the LGBT community. Another theme that came up were people highlighting very specific aspects of the program that impacted them, so specific areas of knowledge or skill that they developed. And one participant wrote that participating in Do You Mind has connected them with people of all genders and orientations to understand how shared issues like body image and confidence are experienced by different subsections of the queer and trans community, as well as how minority stress and stigma compound mental health issues. In the focus groups that we conducted with the participants, we're in the process of analyzing these data, but our preliminary observations have shown that most focus group participants agreed that the program met each of its objectives. In terms of improving the program, participants recommended combining online and in-person meetings where possible, having post-program opportunities to connect with each other and to have their learnings from the program recognized or applied, being mindful of group dynamics as well as the structure and process of the program, incorporating more opportunities within the program to check in about how participants are experiencing Do You Mind, providing more opportunity for connection and in-depth discussions of subject matter, and having better pacing of the pilot intervention projects, as well as linkage to those projects throughout the program. So you can see that in a lot of the participants' recommendations, they are focused on ways to improve or increase their social interactions with one another, both within or during the program, as well as afterwards. So now I'm going to hand it over to our delivery partner sites to share a little bit about their experience with the program. And first up, we have Emily Bailey from YouthCO, she's a program manager there. And she's going to be telling us a little bit about the Vancouver site's experience with Do You Mind? And the participants at this site, they developed an online resource on effective responses for youth mental health challenges for their pilot intervention project. So she's going to highlight some of the experiences related to that as well.
Thanks, Ricky. Hi, everyone. It's really lovely to be here with you today. And as Ricky mentioned, we were implementing this particular program in Vancouver, but we also recognized that through the conversation around mental health and how it intersects with queer and trans communities, that there are also particular ways in which mental health shows up in rural communities in disproportionate ways. And so for our particular implementation, we decided to host the training portion of this project in Abbotsford. And we had folks gathered from across the Fraser Valley that were interested in engaging in new ways of approaching skills around our mental health. As we all know, it was quite the year, and also this project kind of started off with a bang as we transitioned into creating new innovative approaches around responding to the pandemic. And as queer and trans youth, this was a particular struggle that showed up in our communities. And we were really fortunate, however, in BC that when we were working to implement this portion of the project, we had received different provincial standards that allowed us to gather in person while implementing harm reduction strategies to ensure that we were keeping each other safe. And so for some of those critical pieces that Ricky mentioned around the necessity around relationship building and the interconnectedness that really fuels and furthers this work. Some of those elements were possible, although we had to stay a certain distance apart, even when we were in shared spaces with each other. As an organization, YouthCO, we specifically focus on destigmatizing the work around how HIV and Hep C shows up in our communities as well. And of course, this has a direct correlation around how these particular viruses impact our mental health as well. And so part of our curriculum, we also incorporated new learnings around HIV and how Hep C also shows up in our communities. I think too that there was something really special that happened as we gathered with each other where we were able to really name and bring into focus some of the parts of our experiences that have never truly really been met in our communities by particular service providers or healthcare professionals. And so as a result, as we gathered and explored the particular Do You Mind content together, we were able to identify this particular shared experience that shows up for us as queer and trans youth in particular, which is how our agency becomes really complicated as we experience particular mental health challenges in our lives. And so what that can look like in some ways can be around the duty to report that we might not always know the particular ways in which the duty to report can dramatically influence our ability as youth to continue to practice agency and receiving the kinds of care that are supportive to us. This might look like not understanding completely the ways in which our relationship to police show up in our lives, or our relationship to healthcare spaces, hospitals, these kinds of things. And we know that as queer and trans youth, and youth in particular, that we have a very intimate relationship around how agency is pretty consistently negotiated with us when we try to seek support from service providers. And so what was really wonderful through this Do You Mind project is that we were able to think, we were able to kind of take a break from exploring the particular ways in which harm shows up with systemic violence, and getting to bring it down a little bit more into our interpersonal relationships, of thinking of how we as individuals and as peers to each other would be able to show up for each other in the ways that we might feel sometimes just dropped by our communities. And so, as Ricky mentioned, the youth continued to gather to create an online resource which unpacked the particular ways in which suicidal ideation can impact us as queer and trans youth. And what that online resource really has been able to achieve are some really important conversations for us as queer and trans youth around what does it actually look like when we show up for each other in meaningful ways? How do we want to be met? What are the things we hope to hear, that we hope to receive? What are the, very specifics around these skill sets that each of us are actually very capable of adopting and learning in our lives, that, you know, as much as it is important to have implementations available to us in cases of crisis, that there's also such a spectrum of our experience as we experience our mental health ebbing and flowing, and especially during the conditions of the pandemic. What does mutual aid look like? What does community care and systems of support look like in our lives, as we're able to actually intervene in many more instances as we experience challenges with our mental health. So I'm really excited that this resource has been created and can now be out in the world, shared with our peers. So that's us.
Hi, everyone. I'm not sure if I was supposed to introduce myself, but I'm going to now. Hi, everyone. My name is Kirk Furlad. I use he, him, his pronouns. I'm here as the CBRC Regional Manager for Atlantic Canada. I live, work, and play in Chibuktuk, also known as Halifax, which is in Mi'kma'ki, the ancestral and unceded territories of the Mi'kmaq people. I am lucky enough to be representing the Youth Project here in Nova Scotia. The Youth Project's mission is to make Nova Scotia a safer, healthier, and happier place for youth 25 and under around issues of sexual orientation and gender identity. The facilitators couldn't be here today, so I'm happy to step up and speak to this project. I'm a big fan of the Youth Project. I went there when I was a youth because they are celebrating their 28th year this year. So I've been lucky enough to be on this project for quite some time, so I've seen us develop and roll it and then realize COVID was here. So there really was, it's easy to forget now, I think, that it was those first few months where it was sort of like, well, the lockdowns kept getting extended for 2 weeks to a month and you weren't really sure what would happen. So in Nova Scotia, we did decide to go the online only route so that it wouldn't be possible, so that we didn't have the risk of, running out of planning for it entirely online and then having to cancel it at the last minute, which had some advantages for us. The Youth Project is a provincial organization, but at the same time, there are physical offices in Halifax, so that tends to be where most of their services are delivered. So the switch to online was a great opportunity to reach youth all across the province. As well, most of the youth who attend the physical youth project spaces tend to be much younger youth. They basically stop going around between 15 and 18 because, when you're 18 years old and the person next to you is 12 years old, you have some things in common, but not a ton. So we did decide to go online at the end of the summer. Our project that came out of it was a zine writing workshop. Participants really wanted the opportunity to allow other youth across the province to engage with this chance of storytelling. Storytelling was a major theme in the work that we did in the curriculum delivery. It's actually in the curriculum, but also we had local writer come in, speak about her work. And it just seemed to be something that kept coming up over and over again with our different presenters. So we were lucky enough that after the curriculum delivery happened, we could all get together. While we had tried to recruit people from across the province, it just happened that everyone who stuck around for the entire program was from Halifax. So we were actually able to get together and share a meal when restrictions allowed. And that's where the idea of a zine came up. Storytelling was so important to the youth, and they picked the theme of small wins, queer victories, because so often their stories are not in the media, or they're very, like the standard heteronormative pleasing love Victor sort of thing, or love Simon. I've not seen Love Victor, I shouldn't trash that. Or their tragedy narratives. So they wanted a chance to give youth a space to write stories about their small wins and the big queer victories. Coming out to someone, that's a victory. It may feel terrifying at the time, but you did it, and you're going to keep living out, and that's another victory that we really wanted to celebrate. So we had 2 online workshops. Youth anywhere across the province could participate. We said you could attend one or both, and we had another youth who is a writer lead the workshop itself. Delivering programming online during a pandemic, it was the first time any of us had actually done any online specific programming. So there were lots of lessons learned, like, how much time you really want to book an online learning session for is a lot less than what we did. And, the fact is the staff, we're already trying to do a lot of programming online. So they didn't necessarily, so scheduling proved to be a challenge. While we did get people from across the province, it also still gave people a chance to connect, especially when we got to meet in person. As Emily and Ricky both said, the idea of some sort of hybrid blended model where people could actually get together at some point was very appealing, because it is a lot harder to socialize online. Also, our presenters, we had a lot of great guest presenters. They also had found the same challenge. A lot of them asked if they could come in for the entire session, because they wanted to see what other presenters were doing. They wanted a chance to interact with the participants in some way. Because if it was real life, like if we were having like a weekend event, the presenter might come in like 15 minutes before their session. We'd have a break. They'd come in, they'd talk to people. They might stay around for lunch afterwards. Not as much an option online, because we also try to push for shorter presentations, right? We didn't necessarily want people, we wanted to keep it short and snappy to try to keep people's attention. But everyone was generally pretty understanding of the limitations of online. The social connections were the thing I think that worked best. It was a small group, but they all seemed to gel together over time, and they enjoyed working together. One of the things I've learned, if you're doing online training or something, the tools really do matter. We use Google Meet. We did that for a couple of reasons. It has closed captioning, which is free. We also, there were like built-in tools like Jamboards. So, that was a chance for people to be a little bit more creative. Like if we were in person, we would have done activities, like break out into smaller groups, or Dotmocracy, or like, God, the sticky note thing, where you like write ideas down. Not as easy to do online, but we were able to use some online tools to sort of like try and get that a little bit more engagement, rather than people just sitting there like a virtual online class. We, didn't have breakout rooms then, but if we did now, we probably would use it. You do sort of have to force the social time, I have to say. We did a lot of check-ins and check-outs. And it may have been like silly and annoying at the time, but I do think that it worked really well, because it gave people the chance to get to know each other. Sometimes the questions were, pretty generic, like, what did you do this weekend? Other times they were like, if you had a superpower, what would it be? And it was just ways to get people talking at the very start of the meeting and at the very end, just to get the relationships going. And we're still a few months out. The Zine workshop is done. The Zine is a little bit delayed, but we had, like, as far as I know, all of our youth enjoyed their time, and they are looking forward to moving this on to the next stage. And with that, I'm going to hand things back to Ricky. Thank you very much, everyone.
Thank you, Kirk. And thank you, Emily, for speaking beforehand as well. Next, I'm going to hand it over to Holly Att. Holly is a community coordinator with the Edmonton Men's Health Collective, or EMHC. EMHC is our Edmonton partner site. And Holly's going to tell us a little bit about their experiences, including the 2SLGBTQ+ intergenerational mentorship program that the Do You Mind participants there completed for their pilot intervention project.
Hello, I'm Holly, like Ricky said, and I'm coming to you from Amesquasi-Waskahikan on Treaty 6 territory, or so-called Edmonton. I'm going to spend most of my time talking about our intervention. So it was a bit unique here. With our intervention, we had two sets of participants. We had our Do You Mind participants who created the intervention and launched it. And then we had our intervention participants due to the type of intervention that we decided to create. I'll talk a little bit about the Do You Mind cohort though. So because of COVID and the programming being completely online in our case, we were able to extend participation beyond so-called Edmonton. So actually around a quarter or a third of our participants came from Lacombe, which is a smaller town still in Treaty 6 territory, not too far away. And we even had a participant from Lethbridge on, I believe, Treaty 7 territory. So we were able to, that was, I guess, one benefit of the online aspect was, I guess, accessibility based on geographical location. And anecdotally, I think maybe that our cohort makeup may have also influenced our choice in intervention, which was Alberta-wide. So I'll start with around September, we finished our health literacy modules and began the process of our project concept ideation. So the cohort was facilitated through a series of divergence and convergence exercises and consensus-based decision-making processes to develop a outcome statement. And so what the cohort developed was the statement, connecting people from different parts of the queer community to combat social isolation. And along with that, the cohort had a few non-negotiables or aspects of the project that they really wanted to see. And some of those were that the project would be multi-generational, would bridge rural and urban communities, would include mentorship, and build sustainable connections. So out of all of that, the cohort decided to create a 2SLGBTQ+ intergenerational mentorship program. So once we came up with that idea, we then invited community members to come and consult us on how that idea aligns with community needs, and also to provide us with some key considerations into how to develop the project and into its implementation. So the initial objective statement was then broken down into three sort of sub-statements, or the objectives that we would use to promote and evaluate the project. And these were to combat social isolation, to facilitate intergenerational connections and knowledge sharing, and to reinforce cultural identity and a sense of belonging. So once we had developed our project concept, we then moved into the real nitty-gritty of project development. So the Do You Mind participants and coordinators developed a work plan and shared core tasks in the design of the project. The project was promoted on social media and through snowballing through the Do You Mind participants, and applications to the intervention pilot project were made on the Edmonton Men's Health Collective website. So due to the nature of our intervention, the Do You Mind cohort participants kind of ended their involvement with the project, when it launched. So that's because now we were accepting another group of participants, and so due to confidentiality and other ethical reasons, the Do You Mind participants launched the program, but then took a step back and were continually updated on on what was going on. So another aspect of our mentorship program was, because of its limited scope and time frame, we developed 3 broad categories from which participants could choose to focus their mentorship around. So these included the categories of coming out, service navigation, and dating and relationships. However, participants were encouraged not to feel restricted by these categories and were encouraged to explore categories related to identity, mental health, and community, not limited to faith and spirituality, family, labels and language, media representation, and more. We had 27 applications for the mentor role, and this was the end of December when we launched the program and started receiving applications. We had 47 applicants for the mentor role and 29 applications for the mentee role. We had thought we were only going to have around 7 pairs, but because of the interest, we increased that to 12. So we accepted 24 applications total with 12 mentee-mentor pairs. Participants were from diverse geographic locations, ages, gender identities, sexual orientations, cultural backgrounds, races. The way that we selected the applications were, we began with the mentee, and we considered expression of need. So some examples of that were identified lack of social supports, being new to the queer community, or living in a rural area, for example, with few queer resources. And once we identified a mentee, we then would select a mentor for that mentee. And in doing this, we considered the selected mentorship category of interest. We also considered the priority of creating an intergenerational relationship, and as well to facilitate a lasting social connection. And the way we considered a lasting social connection was, we looked at shared intersectional identities, location, and other personal preferences identified. Of the 12 pairs, we retained 11, and 10 met or exceeded the mentorship time commitment, which was 6 hours total of mentorship sessions, 1 hour per week for 6 weeks. So 10 met or exceeded that, and then 8 pairs completed the post-intervention evaluation survey. The structure of the program was, like I said, it was 6 weeks. We began with a mentor orientation session, followed by a welcome session for all participants. After this, mentee and mentors would schedule weekly sessions with the help of a shared Google Calendar, shared Google Drive, Zoom, a mentorship orientation package, and the incentive of Uber Eats gift cards for every session that they had scheduled. We did a mid-program check-in with everyone about 3 weeks into the program by phone, we being the staff, the coordinators. And then finally, we had a final wrap-up session with everyone where participants had the opportunity to give feedback and to debrief as well. So some of the feedback we got at the midpoint check-in, which was actually similar to the wrap-up as well, were that mentee and mentor pairs felt that they were building a friendship and anticipated that that connection would go beyond the program. Participants felt that pairing was done really well. Participants felt validated and supported in their mentorship connection. Participants felt some awkwardness with the one-on-one Zoom conversations, like the Zoom platform, and had some challenges maintaining the conversation or coming up with things to talk about. Some participants also questioned the need for the mentorship categories, as they either felt restricted to the category or that no category quite applied or fit to what they wanted to explore. Similar themes came up in the wrap-up session. In small groups with mentors and mentees grouped separately, experiences were shared around building friendship, feeling validated, being proud of having the courage to show up and be vulnerable, having an increased sense of belonging and confidence in their identity, and coming to have a greater value for community and involvement in community programs. Mentors in particular shared feedback that they would have liked more prompts or structure to follow for sessions, and that continued meetings among mentors as a cohort would have been valuable. Now, I know the evaluation was shared for the Do You Mind program and the Do You Mind participants, but we did an evaluation with these participants as well for the intervention and got very positive results, particularly for the mentees. So I'll just share some of those. We had 87.5% of mentees and 50% of mentors reported increased knowledge about queer supports in their community. 87.5% mentees and 75% of mentors agreed that they gained new knowledge and skills to support mental health with their peers. 100% of mentees and 75% of mentors agreed that they felt more connected to the queer community. 100% of mentees and 87.5% of mentors indicated that they were paired with someone who shared a similar culture or identity as themselves. 100% of mentees, 87.5% of mentors reported they developed a meaningful relationship with their match. 100% of mentees and 75% of mentors also indicated that it was likely that they would maintain a connection with that match. And finally, 100% of mentees and 62.5% of mentors agreed or strongly agreed that they were more likely to get involved with other LGBTQ 2S plus intergenerational projects in the future. And these were just some of the findings from our evaluation, which included also qualitative quotes as well, but don't have time to get into it. But I will summarize some of the learnings from this intervention. We learned there's a demand in Alberta among 2SLGBTQ plus individuals for continued mentorship programming, as evidenced by the evaluation data, the number of applicants, and enthusiasm among participants for more sustainable ongoing mentorship programming. We learned we need to provide more tools and coaching, particularly for the mentors, so that they can facilitate a more structured session if they choose to. So for example, more prompts. We provided some prompts that went with each mentorship category, but it was just one page of open-ended prompts. So more prompts, guides, or an opportunity for mentors to connect and go through the program as a cohort were some suggestions. We learned about the benefits and drawbacks of online programming. Some participants indicated they struggled with the online format and felt either awkwardness, a sense of distance from others, like just reminded that they're not physically with others. Barriers to confidentiality also came up, and also technical and connection problems. However, as noted earlier, there were some benefits to the online format, which included extending participation to rural areas, and also eliminating some of those barriers that in-person programming would present, such as need for transportation or childcare. And finally, we found that the mentorship program has had a very positive impact on mentees and mentors, and that if we were to have future similar programming, that it would be preferable to have a hybrid session, as many others have pointed out, with some in-person opportunities. And it would be useful to provide more opportunities for social connection outside of the designated mentorship sessions. So people did really like that end wrap-up session, the midpoint check-in, and would have preferred more opportunities to gather as a cohort. Yeah, and again, just that there was a high demand for it, and that a lot of participants were excited about the idea of possibly participating again in the future if something like this were to happen again. So I will turn it back to Ricky, I believe.
Thanks, Holly, and thank you again to our other panelists. As Holly mentioned, each of the pilot intervention projects need to be not just implemented, but evaluated, and the GMind participants played a role in developing their evaluation strategies. Each site did one or more surveys with their pilot intervention participants, and although each intervention project had its own specific objectives, and therefore very project-specific outcomes were measured, there were also other outcomes that were measured that overlapped quite nicely with some of the goals of the Mental Health Promotion and Innovation Fund, as well as CBRC's community intervention goals. So looking at data from across the evaluations that were done with each of the different pilot intervention projects, 65% of respondents who participated in those projects reported increased health-related knowledge. 84% reported that they intended to apply the knowledge learned through health-related behaviors. 80% reported that they developed new social connections or meaningful connections to others in the program. And 60% reported increased knowledge of services or the intention to access services. As I mentioned, and as Holly illustrated, each intervention had its own specific outcomes. So a few highlights from some of the site or intervention-specific evaluation data. We found that with the YouthCO intervention, the pilot intervention participants, 75% of those respondents reported increased ability to work with other youth to address mental health issues impacting 2SLGBTQIA+ youth. In the Youth Project's intervention, the writing workshop series, 100% of respondents reported that they agreed or strongly agreed that they felt more confident in their ability to use writing or drawing as a means of self-expression. And with EMHC's intervention, 75% of respondents who participated in the 2SLGBTQ mentorship program, and this is both mentors and mentees, reported that they agreed or strongly agreed that they had more empathy for LGBTQ2S people from different generations than their own. So now I'm going to hand it back over to Brooke to share with us some key learnings and thoughts on future cycles of the program.
Okay, perfect. Thanks, Ricky, and our site partners. Very informative. So just before I dive into some key learnings and future plans, we are going to be moving into the Q&A portion of the session in just a few moments. And so if you do have any questions that have emerged while you've attended the session, do please feel free to put them in the event chat, and then we'll get to them in the Q&A session. So just in terms of some key learnings and future plans, of course, we still have some more analysis of the data to do, but in terms of preliminary analysis, we definitely know that there has been high participant and partner interest. So both in terms of the core program itself, so the participating in the Do You Mind program, but then also the pilot interventions that were developed and delivered in each site. We also know that the program does have its intended impact. And so while there are opportunities to learn and optimize the program, we did see a lot of impact on many of the measures that we were hoping, which is a good sign for the future. There are some opportunities to improve the program. So definitely like improving the curriculum. Like I'd mentioned earlier, we started developing the curriculum for in-person delivery. And many of the sites ended up having to switch kind of last minute to online delivery. And so there were definitely opportunities to improve that program curriculum. And we've already been working on a redeveloped curriculum, which should be ready in the next month or so. So it will be ready for the next program cycle. There's also the opportunity to optimize the program for hybrid delivery. So being able to deliver the program in person or online, or a mix of the two. Of course, we're hoping that the context with COVID will change come the fall, and that some of our programs will have the opportunity to deliver programming in person if they would like to. But as was already mentioned, there were some benefits to the online delivery, like being able to offer the program outside of the urban center to more rural areas. And so there could be some benefit to continuing to deliver the program online or in a hybrid format. And so we're hoping to intentionally develop the program so that it can be delivered that way. And of course, enhancing opportunities for more social connections. As mentioned, there were some challenges with the building connections between participants using the online format. And so whether it's delivered in person or online, we hope to enhance opportunities to foster those connections between participants and between the participants and other partners that are participating. In terms of some of our future plans, because of the impact of COVID, the Mental Health Promotion Innovation Fund has extended the phase 1 for another year. And so essentially what we're planning to do is to run another cycle. So we ran this first cycle within the context of, COVID and the surprise that came with that. And so we're trying to take all the learnings from this initial evaluation, figure out ways to tweak and optimize the program, and then deliver it once more before we look at applying for phase 2 of the fund. If successful in phase 2, we do hope to continue to move forward with expanded delivery. So right now we are delivering the program in BC, in Alberta, in Nova Scotia. We've had partners interested in the program, approaches from Quebec and from Ontario and whatnot. And so we're hoping to continue to leverage CBRC's national network to be able to adapt and pilot the program in other locations. The other thing that we're hoping to do over time, if we're successful in getting into other phases of the fund, is to develop an inventory of effective 2SLGBTQ plus youth mental health interventions. And so for every single partner that delivers this program in every cycle, it will always end with participants developing and delivering a pilot intervention aimed at addressing the mental health of their community. And so over time, after repeating this and new sites, we're hoping that we'll get a sense of what pilot interventions are actually impactful, which ones were less successful and whatnot, so that we can compile an inventory of effective interventions that you can take within your region, within your local context, adapt and deliver to your local community. So those are some things to keep your eyes open for. Of course, just moving to the next slide, some contact information. So if you do want to get in touch, we definitely invite you to. So whether you're interested in just learning a little bit more about the program, getting some questions answered, you can get in touch with any of the local partners, or you can contact Fazia at CBRC if you're interested in engaging with the program as a whole. And so I'll just leave that there for one more moment so people can take a look if they wish and jot that down. The other thing I do want to say before we move to the Q&A is that you will receive an email if you've registered after this event. And so, oh, Ricky's just asking to be unmuted. You will receive an email after this event with an evaluation survey as well. And so we would love if you took a moment to complete that. Sorry, Ricky, did you have something you were wanting to add?
Yes, I just noticed that on this slide, I think some of the logos and the text got moved into different places. So if you're looking to contact Fazia at CBRC, Fazia is a Do You Mind project coordinator. Her information is there correctly. If you're looking to get in touch with the Youth Project, you can contact, their website is located in the bottom right-hand corner. youthproject.ns.ca. You can contact Sky at youthproject.ns.ca. If you're looking to get in touch with YouthCO, you can contact Emily, Emily at youthco.org, or go to the YouthCO website, youthco.org. And then finally for EMHC, their website is ourhealthyeg.ca, or you can contact them at connect@ourhealthyeg.ca.
Perfect. Thank you, Ricky, for picking up on that. And we apologize for the mix-up, everyone. Okay, so I think then we'll just move on to our Q&A. So you can continue to type any questions you have into the chat box, and we'll do our best to try to answer them in the allotted time. So we have our panelists back here. That's great. So just a couple questions that have emerged so far. So one was about the title of the program. So does the title "Do You Mind" have a specific meaning or reference? So happy to turn that over to any of our panelists to touch on.
We actually had like a little branding exercise where we sort of, like when we were in development, the original partners, and so we came up with like lots of potential branding for the mental health leadership project, which is what we were calling it then. And Darren Ho, who is an associate director at CBRC, suggested "Do You Mind," which had that thing of like, like it hopefully will prompt people to think. Not just because mind is in their phrase, but also, it does bring mental health to the forefront. And, you can unpack it, you can use it how you want. It can be like, we were even thinking when we were using it, like, oh, this could be a good like hook. Do you mind that, 2SLGBTQIA youth have, health inequities? Do you mind thinking about your own mental health? So, catchy, a little assertive, a little sassy. Yeah, also because a lot of the other suggestions by this guy were brand names and we couldn't use them. Yeah, Emily, you were also around the time. Any other thoughts?
I think you covered it well, Kirk.
Excellent. Perfect. Just moving on to another question. So sometimes it can feel like community health programming can focus a lot on community deficits. However, with Do You Mind and the pilot intervention component, it appears to focus on leveraging community skills and assets. So can any of you share from your experience about some of the values or benefits in prioritizing asset-based programming when working with queer, trans, and two-spirit youth? Emily, I see you nodding. I don't know.
Yeah, I'm happy to. I think that both are equally important work. And I think that there's something in particular around, as peers, getting to find ways of supporting ourselves and each other. Often, I think that there's a bit of a gatekeeping piece that can happen where we feel, especially as youth, that we do not have what it takes to care for ourselves and each other, and that we 100% need the reliability of service providers in our community to attend to our the challenges that show up in our lives. And as we know, and as it was brought up at the very beginning of this presentation, that the impacts around colonization run deep in our communities and show up in particular ways for queer and trans communities, which means that we will always have a really long way to go when it comes to some accesses to, especially in healthcare spaces or mental health care spaces, where some of us that may be more privileged move in and out of those spaces with ease. We just have a very long way to go until that is applicable to all of us. And so it can be really useful for us to be able to name our particular experiences and come up with strategies in the present, and really begin to unpack and decolonize our own experiences around remembering that we are also the authorities and experts on our lives and our experiences, and that having opportunities that have become available through this particular project are so useful in us just very literally having time and space to be able to honor those experiences, to receive the validation when we name those experiences and bring them into a room and space. And then with the really lovely element of this project of getting to implement some kind of a project and bring that back into our communities, that we're just finding, I guess, more of like a multifaceted approach with responding to community care and support strategies.
Excellent, great answer, Emily. Does anybody else have anything to add for that, or? Okay, Kirk.
Just that I think the youth are also quite tired of seeing like things based in a deficit model. They also really want to, they know they have resilience and strength, and they really want to have the chance to demonstrate that and use that in their everyday lives. At least that was my experience working with youth in Nova Scotia.
Okay, great. Okay, so we'll move to another question. And so somebody asked what you feel might be one of the biggest barriers when it comes to youth accessing mental health services such as counseling, for example. Anyone?
I would just say off the top of my head that I think cost could be a barrier. Relationships with family could be a barrier, whether that youth is out to their family, what the quality of relationships are like with the family. And I think another big one is just LGBTQ plus competency among mental health providers and whether youth feel safe to talk about their queer and trans experience with providers. I think that's a huge barrier.
And I think also for younger youth, if they live with their family and they are not fully out, having to ask for their parents' healthcare benefits to get their seek counseling, that creates real challenges. Which was not my main point, but I've lost it now. One of the other things is, there's just flat out barriers to accessing help for mental health in general. And I feel like, youth is one of those really rare window periods where we can hopefully get to them and be like, listen, it is time for start talking about it now. But the fact is, I feel like a lot of 2SLGBTQI plus youth sort of assume that they're going to be rejected by healthcare providers. Unfortunately, unfortunately that is, and with perfectly good reason. But unfortunately, that's not something I think we've conquered yet.
Okay. Another question came up, which was specific to the mentorship program, just around the matching of mentors and mentees. So was there a specific criteria to determine which mentor would be matched with a particular mentee?
Yeah, there were. So we chose the mentee first, like I'd mentioned, but then I didn't go into detail, but we actually chose 2 potential mentors for each mentee based on the category that was selected, whether that be dating and relationships, coming out, or service navigation, and also based on trying to create an intergenerational matching. So we did look at age there as well. And I should note that not everyone got an intergenerational matching because there were actually quite a few youth mentor applicants. So some of the mentee mentors were actually both youth. So those were 2 things we considered. The third was the probability of creating a lasting social connection. And what we looked at there was shared intersectional identities. So there was a spot on the application to identify, it was optional, but to identify what identities might be important to consider when matching. So we looked at that, as well as in that third category, location and any other personal preferences identified in the application. Yeah, it was tricky, but I think it worked out pretty well.
So there was a question specific to potentially the opportunity to expand the mentorship program to include other areas in Alberta, or to partner with another organization in Alberta to potentially scale up that program. And so what I'll say for that one is to either contact Fazia or the EMHC email directly. And I'm sure that either CBRC or representatives from EMHC would be happy to at least have that discussion with you. But a similar question that's a little bit more general is just around scale up or sustainability of some of the pilot interventions. And so you all did really unique, interesting, participant-driven pilot interventions. Of course, given the nature of a pilot is that it runs for, a shorter amount of time, and then you evaluate it to try to assess its impact and whatnot. Do any of you have any plans or desires to potentially sustain these programs or scale them up in the future within your local context?
So speaking on behalf of the Youth Project, so the Zine writing workshop was so popular, and they actually had another unrelated Zine project happen at the same time. So they did find it was, a good way of getting youth that they wouldn't normally get in, and the feedback from those workshops was great. People really enjoyed their time. So I think they are looking at, even if it's not part of Do You Mind, just trying to find other ways that people can, get together and create collaboratively. That's the mixture of C letters I was looking for.
Yeah, I think for us, some of the elements of the pilot project also were around, again, sort of skill-based. And so I think what working on a peer-led online resource allowed is for folks to learn what was necessary in actually creating something that's in conversation with each other. I think often as youth, we receive resources that are where we're spoken to, and there's information about like, you can do this or you can do that. And so I'm hopeful that this particular resource will be in circulation and always be have a long-lasting stability in terms of being consistently available to folks who find their way to our website or connect with us on social media, and to other partners in our that we are connected to. And I'm also really excited by what I think was learned in those moments of really folks getting to experience what that shift feels like around getting to sort of, again, step into a place of agency around how do we talk when we have a need or have a particular experience. What does it look like to actually name that and to speak to each other and be able to make requests of each other and our peers? So I'm excited that that will live in the bodies of the people who got to participate in that particular part of the project. And I hope we'll continue to see in further work that comes in, just by them being in the world.
Perfect. Excellent. Thanks. So I have time for a couple last questions. So one question was just around which platforms were used to gather with the youth for those who did either, solely online or hybrid delivery, and, whether you found them to be particularly useful or.
So in Nova Scotia, we use Google Meet because it did have closed captioning, and we recognize the value for people who are deaf or hard of hearing, or for whom English is their second language, or if they're neurodivergent, sometimes the text helps them stay on track. But also one of the things we liked about it was that there were more and more plugins, that made it more fun and more fun. And like I said, like the Jamboard where people could go in and draw or post pictures together. I don't know about the other sites.
Here in Alberta, we use Zoom both with the Do You Mind cohort and with the mentorship program as well.
Great. So just a couple final questions here. So there were some questions around whether or not there'd be an opportunity to expand this programming into Ontario, particularly Northern Ontario. So what I'll just say is that we're pretty game at CBRC to collaborate. And so while we may not be able to go full speed ahead right away due to the gated structure of the project, we're always happy to talk with partners about the possibility of adapting and delivering our programming elsewhere. So please do get in touch. And what I'll have is, instead of ending on the thank you slide at the end, Ricky, can we maybe go back to that contact slide? Because it sounds like some folks will be wanting to get in contact with different folks who are, oh, there you go, great. And so Ricky had already mentioned that the logos and stuff are kind of all over the place. But if you have a question of who you should contact, contacting Fauzia is probably the best person to contact, because Fauzia can always filter specific questions or comments to other folks who are engaged with the project. But we're very happy to talk about Ontario and whatnot. So just to wrap up, just a couple final questions. We're probably not going to have a ton of time to get through all of them. So one question was for Emily, Kirk, and Holly: what are some fun and engaging or promising practices that other agencies or professionals ought to consider when working collaboratively with queer and trans youth?
I only have one thing, so I'm just going to say it, and then other people who are a little more familiar with boots on the ground. Assume that they are leaders and give them that opportunity. because they will surprise you in the best ways possible, because they know their needs. They are happy to speak up to their needs if you give them the chance.
Okay, great. Another, unless was somebody about to say something?
Yeah, if I could just add one more comment. This isn't necessarily fun, but I think maybe a useful place to land as well at the end is that what I think is really a wonderful offering from this particular project is that we are talking about mental health, but we're also talking about it within much larger context that we are inheriting as queer and trans youth, which is the legacy of the relationship between how mental health has been articulated, particularly in what is currently referred to as Canada, as queer and trans people. And so that intimate relationship is deep and complex. And even today, we are living in circumstances where our gender identity, our sexual orientation, and the way in which other aspects of our identities around race, ability, all of these different contexts are still explained away through mental health. And that's a really complicated and nuanced piece, which is so wonderful to be held in this project. And I think for service providers, this is a piece that is often left out of the conversation when we're talking about queer and trans literacy. Pronouns are super important. Understanding the ways in which we talk and relate to our bodies are also very important, but not acknowledging that longer legacy can also really keep us from building the kind of trust and relationship with service providers that we so desperately need right now.
Perfect. Thanks, Emily. So that brings us to the end of our time here. I apologize. I know there were a couple additional questions, but like I said, please do feel free to get in touch with us. We're happy to address some of those questions after the fact. Oh, it looks like Ricky managed to magically get everything right for the contact information. But please do feel free to reach out to us either at CBRC or to one of our partner organizations, and we're happy to follow up with any questions you have. Or, just like if you're interested in maybe partnering with us or getting involved. So thank you so much for joining us today. Thanks to all of our panelists. Like I said, you will receive an evaluation via email. We would really appreciate it if you took the time to do it. So thanks and have a great day, everyone.